This presentation is on anti-infective drugs. I would like you to read a section of your textbook, and that is on pages 112 to 125. So normally our immune system takes care of infections, so diseases that are caused by microorganisms, whether they are bacteria, viruses, fungus, or protozoa. And we're going to discuss our immune system in their physiology section. When anti-infective drugs are necessary is when our immune system has not been able to overcome the infection. And so our immune system needs a little bit of help in getting rid of the underlying cause of that infection. Anti-infective drugs have come a long way. So in the 19th century, surgery was a risky business. People at that time believed that sickness or illness came from within a person instead of being caused by microorganisms. So at that time, we had no knowledge of microorganisms. And so patients that were undergoing routine operations were at a very high risk of infection. Surgery was not performed under aseptic conditions, so the operating room, the surgeon's hands, surgical instruments were all laden with microbes that they had no idea existed. And you can see a picture. This is an operating theater, and you can see that nobody's wearing gowns or masks, or in fact they're operating in their Sunday best, it seems. And so because of this, it caused very high levels of infection, and therefore having surgery resulted in a very high risk of mortality. Surgeons often operated wearing their street clothes without washing their hands. They used ordinary sewing thread to suture the wounds, and then they stuck the needles in their coat lapels in between patients. One of the first people to recognize the existence of microbes was Louis Pasteur, and he developed what he called a germ theory. And the experiment that he did was he took a liquid broth and he put it in a swan-necked flask. So this is a flask that does not allow things to kind of sprinkle into it. And so that dust can't enter the top of the flask because of this curved neck that you can see right here. So he put this liquid broth and he boiled it to get rid of all sorts of whatever microorganisms, living organisms might be in there, and then he weighed it. And as long as nothing was able to enter the flask, there was no sort of microbial growth that occurred. But if he boiled it and then broke the neck of the flask and waited, then he got microbial growth. And so he demonstrated that organisms, in this case it was bacteria, were responsible for fermenting wine and for souring milk. His name is still used for the process of getting rid of microbes in milk, and that is called pasteurization. And that's the process that we use right now. So we remove the bacteria by boiling and then cooling that liquid. So his theory was that these microbes that were responsible for fermenting wine and souring milk could also cause disease. Then a surgeon in 1867 named Joseph Lister, and we still see his name around these days. The product Listerine, for example, uses his name as a basis. He founded antiseptic surgery, and so he was one of the first surgeons to use some sort of method of creating aseptic conditions in the operating room. And so in this case, he used a solution of phenol, a type of alcohol, and he misted it around the operating room, including the instruments and the operating table. And as a result, had much, much better results following surgery, so lower levels of infection and lower mortality. Now, of course, we know that microorganisms are the underlying cause of infection, and we are able to identify several different types of microorganisms that can cause infection. And these include bacteria, viruses, protozoa, fungi, and parasites. We also know how they're transmitted. So they're transmitted from person to person in a variety of ways. Some of them are what's considered airborne, which means that they can travel floating in air on little droplets and can be inhaled. Some of them require physical contact between people in order to move from person to person. Some of them are ingested, so when a person drinks contaminated water or eats contaminated food, then the microorganism enters the body that way. Sexual contact, and some can be transmitted by a vector, such as an insect. So for example, the parasitic protozoa that causes malaria is transmitted to humans through the certain types of mosquitoes. These pictures up here, just to start to get an idea of what these microorganisms look like, and we've got some great technology to provide really high magnification pictures of what they look like. So this is a bacteria. This is Staphylococcus bacteria. This is a virus. This is actually HI, or human immunodeficiency virus. And this bottom one is a protozoa, which is called Cryptosporidium, which can cause some GI illnesses. Just a note that now we know that not only are microorganisms cause disease, but some of them are helpful. So many types of bacteria live on our skin, live in our bowel, and they help us. So bacteria in our bowel will manufacture vitamin K. They keep more dangerous bacteria and other organisms, fungi, from invading and overpowering, inhabiting on our skin and in our bowel. So we live in a sort of a symbiosis with these microorganisms, and sometimes they can make us sick. So as I said, normally the immune system takes care of invading microorganisms. Infectious disease occurs when our immune system is unable to take care of those invaders, and it could be because we have little or no natural immunity to the organism, and so it takes time for our immune system to make antibodies and get prepared. And so sometimes the first time that we see one of these microorganisms, we get sick with those symptoms. Usually when if that same microorganism invades a second time, our immune system is ready for it and reacts right away and with force, maybe so quickly and so forcefully that we don't even know that that microorganism has invaded. We don't get any symptoms. Sometimes the number of invading organisms overwhelms our immune system, and it takes our immune system a while to catch up and get rid of them, and in the meantime we get sick. Or it could be that a person's immune system isn't functioning properly. So for example, with acquired immunodeficiency syndrome, or AIDS, a person's immune system is really compromised, and as a result, lots of microorganisms that invade can take over because their immune system can't get rid of them. Keep in mind also that an infection of microorganisms could be local, so it could be just confined to one particular part of the body, or it could become systemic, meaning that it travels in the blood and it affects all over the body at the same time. We're going to talk about our immune system in more detail in physiology, but this is one of my favorite pictures. This is a macrophage, which is a type of phagocyte, which is a type of white blood cell, and macrophages eat up microorganisms. They kind of go out and surround them and then envelop them and then eat them up. And so this is Staphylococcus bacteria, and here's a macrophage on the hunt. One of my favorite types of cells is a macrophage. Okay, we can control microbes with certain agents. An agent that kills microbes is called a cidal agent. We can also control their growth, so we have agents that won't kill those microorganisms, but they prevent them from reproducing, and that sometimes can allow our immune system to catch up. We call those static agents. If we want to completely eliminate all viable organisms, then we can use a method called sterilization. And so we can use very high temperatures, or we can use UV radiation. What you see in the picture is an autoclave, which uses a very high pressure saturated steam, so about 121 Celsius. And after about 15 to 20 minutes of this very high heat, then that will eliminate all viable organisms. Of course, hand washing with soap, friction, and warm running water is one of the most effective ways to control microbes. And although it seems like your mother nagging you again to wash your hands, in fact, that is probably one of the most effective ways to prevent yourself from getting sick and prevent others from getting sick too. Some other terminology. When we talk about something that is an antiseptic, we're talking about something that kills microorganisms, is safe enough to be applied to the skin and mucous membrane, so external applications, but should not be taken internally. Often these agents contain a lot of alcohol and as a result shouldn't be taken internally. And so this is methanol as opposed to ethanol. So alcohol, for example, iodine solution, some detergents, those are all considered antiseptics. When we talk about a disinfectant, that is something that also kills microorganisms, but isn't safe to apply to living tissue. So these are things that we would include in our cleaning products. So things that contain chlorine or lye or copper sulfate or ammonium types of compounds, formaldehyde. And so we use these to control growth of microorganisms on inanimate objects, so surfaces of counters or things like that. Just a note, you don't have to have a substance that contains an antibiotic, and we'll talk about what that means later, in order to kill microorganisms. So things like ammonium or alcohol or formaldehyde or chlorine compounds on their own, even friction, soap, and water, is enough to be able to get rid of microorganisms. So you don't need to have something that has an antibacterial component or an antibiotic component to it. I think it's important to be able to understand the microorganisms that you are trying to control, and so this is a very brief description of different types of microorganisms, and we'll start with bacteria. So bacteria are single-celled living organisms. They have deoxyribonucleic acid, or DNA. They're very simple. The DNA is actually circular. They may have all sorts of little other appendages or things that help them become mobile or do their particular job. Bacteria can cause symptoms of an illness or disease by a couple mechanisms. One is that some bacteria release toxins that damage body cells, and that's what, as those cells are destroyed, that's what makes us sick. They can also trigger our immune system to have an inflammatory response, and that very response from our immune system can also damage cells and make us sick. This, just by the way, is an incredible scanning electron micrograph photo of bacteria that are injecting. So these little dots are the bacteria, or sorry, these little cone things, these are bacteria, these rod-shaped things, and this is a cell, and the little dot things are toxins, and this bacteria is injecting this host cell with toxins. Caught in the act. We can identify bacteria on three different bases. Bacteria can be classified based on whether or not they need oxygen or don't need oxygen in order to be able to live. So if a bacteria needs oxygen, we say that it is aerobic, and if they don't, then we say that it is anaerobic. Aerobic bacteria are more likely to infect surface areas or our respiratory tract, so in our lungs. Anaerobic bacteria are found in oxygen-free areas, so for example in our bowel or very, very deep puncture wounds. We can also identify bacteria based on their shape. So there are three kind of major shapes. Cocci, or spherical shape, so this is Staphylococcus bacteria. Bacilli, or rod-shaped, so this happens to be the Mycobacterium tuberculosis. This is the bacteria that causes tuberculosis or TB. or spiral shaped, and this happens to be the Treponema pallidum, which is the bacteria that causes syphilis, is that as an example. Here are some other just beautiful pictures of bacteria. This one up here is Streptococcus bacteria. It looks like little beads on a string. That's the bacteria that causes infections like strep throat. This one is Staphylococcus again. This is another common bacteria that causes infections. You should be able to recognize by the end of this year Streptococcus and Staphylococcus bacteria. As you should be able to recognize this one up here. This is E. coli, which is a rod-shaped bacteria. And this bottom one is Borrelia burgdorferi, which is a spiral-shaped bacteria, and this is the one that causes Lyme disease and is injected by a tick. The third way, to identify bacteria is by the bacteria's reaction to a particular type of staining technique called gram staining. So if we use this staining technique and the bacteria takes up the stain and as a result turns a purplish color under the microscope, then we say that it is gram positive. And so those are those bacteria that are in the right hand side of the picture. So the reason that these type of bacteria take up the stain is because it's a very special property of its cell wall. And so Streptococcus and Staphylococcus bacteria are both gram-positive bacteria. Because their cell wall has this special property, it means that they're going to be more receptive to certain types of antibiotic drugs. And so that's why identifying a bacteria as gram-positive gives a physician a suggestion as to what types of antibiotics would best work for that type of bacteria. On the other hand, on the left-hand side is an example of gram-negative bacteria where the bacteria do not take up that gram stain, and as a result they appear red or pink under the microscope. And this is an example of E. coli, which is a gram-negative bacteria. Other gram-negative bacteria would include things like Salmonella, Neisseria gonorrhoeae, which is the bacteria that causes gonorrhea. Another example of gram-positive bacteria would be Listeria. Okay, so let's say that you've got a really, really sore throat and you go into your physician's office and we want to know, is this a bacterial infection or is this a virus? And if it is a bacterial infection, we want to know what type of bacteria and we want to know what drug will best work against that particular bacteria. So the process of identifying all of those things is called a culture and sensitivity test. And we need a sample of that bacteria. So we could take a blood sample or sputum or a throat swab or urine or stool or pus or whatever, and we can take that sample of bacteria and put it into a petri dish and then grow it. Growing that bacteria, getting enough of a sample to be able to test particular antibiotic drugs can take between 24 to 48 hours. Now in the physician's office there's often a very quick test that they can use that takes minutes in order to identify whether or not it's bacterial. But in order to be able to determine what drug is going to work best, they need to actually grow a larger culture of it. And so that's what you see in the upper right there. Then what they do is that they take little tabs of different antibiotic drugs, different drugs that may affect that bacteria, and they put those little tabs in the culture dish. And then they can see which drugs have the biggest effect on that particular strain of bacteria. So if you look at this bottom right corner, we can see that this particular drug in the upper right-hand corner has a huge effect. It seems to have destroyed or inhibited the growth of all of the bacteria surrounding it. Whereas the drug that's contained in the tab in the bottom left-hand corner, this seems to have very little effect on that particular bacteria. So this is important because this will determine, which types of antibiotics a person should be prescribed. This is why sometimes when you go into a physician's office and they prescribe a drug, and then you may get a call from the office saying, we've just got the results of your CNS test or culture and sensitivity test, and it says that you should be taking a different drug. And so they'll ask you to stop taking the one you're taking and go and pick up a new drug. And that's why, is because they found through this test that there is a drug that will be more effective. So if the infection is severe, while they're waiting for the results of this culture and sensitivity test, they will prescribe what's called a broad spectrum antibiotic. So this is an antibiotic that seems to work for large numbers of bacteria. And again, later on, if they get a better result with something more specific, they may ask you to change that drug. The physician can also make an educated guess of what bacteria that is based on a number of factors. So for example, what is the site of infection? So if it's in the throat, for example, then Streptococcus is a good guess. How severe the symptoms are, the source of the infection. So for example, if everyone in a household has got has acquired strep throat, and then the last member of the household comes into the physician's office, there's a pretty likely chance that that's what it is. Or the prevalence of similar illnesses in the community at the same time. So that day that physician has seen 10 people with strep throat, and then the next person comes in with a sore throat, then again we can take an educated guess that person may have strep throat also. Okay, so that answers this question here, which is, while waiting for the CNS results, a physician may prescribe an antibiotic to treat the infection based upon the site of the infection, the severity of the symptoms, the likely source of the infection, the prevalence of similar illnesses in the community. So the answer would be all of the above. Okay, we're going to stop here for now and resume in part 2.